I welcome you again very warmly, dear viewers and dear audience, to our health television program. I'm glad you've tuned in. And many of our viewers have already received solutions from us for various problems they have with their health. And today we want to focus on a problem again, namely joint issues. Pain caused by problems in the joints, which are very widespread nowadays in our population. As we get older, our skeleton develops problems due to various strains, perhaps also due to poor posture, pain from accidents, so the causes of joint pain can be numerous. And we have a guest here today. I'm already looking forward to hearing from one of his patients who will talk about his experiences. And in my opinion, it's always the most authentic when people who were affected by problems, who found a solution for them, speak for themselves and share their stories. Therefore, I cordially invite you. Perhaps you are also affected, and maybe it's also a solution for you. So stay tuned. We're starting right away. Hello, dear Harald. Welcome first to you, before I turn to your patient who is already present here and connected with us. May Harald Burgard, specialist in internal medicine. And you have actually a long-standing, how should I say, a well-known therapy form. You continue to use it and see great sense and great improvement for your patients. And I am pleased that you brought a patient here with us, in a figurative sense, whom we can now speak to right away. And I'll turn to him right away. I also warmly welcome René Heinis, who is connected via Zoom. Welcome. Nice that you are here and that you take your time for this conversation.
Good evening, everyone. Hello.
Wonderful. You were virtually affected, and I would now simply ask you to tell a little about your story, your health or illness history. What was your issue, what was your difficulty, and what burdened you physically?
So I've had severe knee problems for almost 40 years. I was 19 years old when I had my first sports accident playing football. I used to be a passionate footballer. Then at 19, I had a cruciate ligament tear. The meniscus was damaged, everything, etc. It was treated classically back then. At that time, it was still a bigger deal. Major surgery, open leg, 10 days in the hospital. Today, it's all a bit different. Then 10 years later, the same thing with the left knee. Of course, I didn't stop playing football. I actually enjoyed doing it. I would still do it today if I could. Again, cruciate ligament tear, menisci, various operations. Then at some point I realized at 40 that I'm not so great at soccer. Then I shifted to running, swimming, hiking, etc. Then my knees started getting worse over the years. Severe knock knees, especially my right leg became a knock knee. Then at some point I couldn't run anymore. I could no longer properly hike down the mountain. And then about a year and a half ago, I first heard about gold implantation therapy from Dr. Burgard. I thought, well, I'm not so sure if it's for me. Then I watched the YouTube videos, etc. Then at some point I said, yes, I'll try it out. Earlier this year in February, I had the first appointment with my right knee. My right knee is significantly more painful than the left one. It's now been 2.5 months. The pain has already gone down by more than half. I can move better again, even the mobility, so I could bend my knee to a maximum of 110 degrees. Even the mobility has become a bit better.
Save time searching and researching, and browse through our holistic medicine database with the integrated Kaisana on Wikisana.
That is the current status. I still hope that it will get a little better. Then I can live with it very well, and maybe also engage in some more physical activities. That would be my goal. I only had the left knee operated on 2 weeks ago. Still very fresh. I don't have such strong problems there, but I can already notice that it's getting better. Although, of course, I still have wounds from the surgery, it's still a bit blue and green, quite normal. But I can already feel that it's getting better. It's a big rupture from my knee and me, so my knee problems have been with me my whole life. But it also brought me a lot. I do a lot of gymnastics exercises, do strength training, etc. for the muscles, to keep it up. From that perspective, I probably wouldn't have been able to postpone it for so long. That's how I see it.
How was it beforehand, before the gold implantation? What treatments could you access from conventional medicine?
You try first of all with classical physiotherapy, rest, and then at some point it's about taking painkillers. That's a no-go for me. When I have to start with painkillers like ibuprofen or whatever, then it's clear to me that it won't work. And then, of course, I tried several, I can't mention everything, various remedies, etc. And nothing really helped in the long term.
So did you just endure the pain during that time?
I endured the pain. As I said, I changed my sports, first football, very bad, then tennis, not much better, and now I'm mainly walking and jogging. Not necessarily, I weigh over 100 kilograms. I'm relatively tall. That's also not quite ideal. But now I can at least run again. So in Switzerland, I mean running, not jogging, but hiking, etc. Swimming, aqua jogging, etc. Everything works. Just needs a bit of discipline. That's just part of it. The doctors told me my right knee, that had already been predicted many years ago, we should actually replace it already. And I just didn't want an artificial knee joint at 50. By now I'm 60, and I am fine that it continues like this as it is now. The pain has already gotten much better.
So I find your attitude, your stance actually very nice when you say, so these painkillers, I'd rather endure them than take the side effects that they also have, again, just because I then have no pain, because the painkillers they naturally have in many respects. It is a decision between the plague and cholera, I would sometimes also like to say. They do have consequences, especially if you have to take them long term, which in any case would have been relevant. Did you want to say something? And therefore a healthy attitude.
I wanted to say something. For me, it was never a topic. Painkillers. I already wanted to know for myself, should I take painkillers or not? Because if I take painkillers long term, then it's clear what happens. Or will I eventually become addicted to them? And then I not only have mechanical problems, then sooner or later, there are also entirely different problems.
Yes, right. And it is, of course, also nothing can replace your own knee. Of course, there is the possibility of artificial joints, but it's just not more the natural, not the own knee anymore. Right? That's why I can understand that I would probably be the same.
Well, he's still young, yes, exactly. And if I now insert a knee, where I know it'll last, let's say 10, 15 years, he'll have to do it again somewhere around 70, 75. Even that doesn't last forever, and you can't endlessly replace such a knee. And of course, as he just said, painkillers are not a long-term solution. I can take them if I have an acute inflammation, but I can't take painkillers for 20, 30 years. I can do everything, but that, of course, causes considerable damage to the kidneys and to other important organs. And then eventually, he needs dialysis or something else happens.
Okay. Can you also, Mr. Heinis, tell us something about the procedure in terms of gold implantation? For the viewers who might not be familiar with it yet, what is it then? How did you find and perceive the procedure? Or actually, you already had two.
Yes, correct. So the whole thing was relatively uncomplicated for me. I was there. So first, of course, I was informed about everything that could happen, as is normal, etc. I knew beforehand exactly what would happen. They explained it to me, and I arrived there about half an hour earlier. Had another conversation with Dr. Burgard. We went through everything again, from his side what exactly he does, and explained again what happens. Very important. Then I was prepared in the operating room. Everything as usual. Then I received injections from Dr. Burgard for, anesthetic injections around the knee. That was essentially the only thing that was a bit uncomfortable, but that's normal. And afterwards, the procedure came with the hollow needle injecting the small gold particles in there. In that regard, I didn't really feel it anymore anyway.
It was local anesthesia and an outpatient procedure.
An outpatient procedure, all in all, the day was 2 hours.
And after that, how was it for you, your sensation?
As I said, didn't feel anything in my knee. And then I drove home again. And I had 1 or 2 days where I was a bit pressure sensitive. So when I'm lying in bed, the nerves, you have to be a bit careful there or so. It was very, very slightly swollen, so not dramatic. But simply from the procedures, 1 or 2 bruises and the wound healing, which is practically completed on my knee now. From the procedure standpoint, in my opinion, it's really minimal.
Okay, now you had both knees done in relatively short intervals. Was the decision already made in the beginning that it would be both knees? Or did you decide for the other one after the first time?
No, that wasn't clear from the beginning. I first had the right leg, which gives me more problems, operated on. And there I already felt a strong improvement, which made it clear to me that my left one, which isn't quite as bad yet, would be done too.
Yes, okay. Yeah, you don't have to wait until it gets really bad. That's probably how you thought, right?
Yes.
Okay, yes, very good. Well then, yes, the procedures aren't that long ago now, as you mentioned. And you can probably still expect great improvements, I would assume.
Yes, how is it with climbing stairs? Is that possible again now, or is it still a problem?
So with climbing stairs, I still always had problems with the right knee. And in terms of angle, it wasn't quite that bad. That works again. It's better again. So in the 2 weeks I was with him, in the care center, the right knee has gotten a bit better again. Climbing the stairs is fine. What is still not so good is walking downhill for a longer time. I'm still there. I still have to be a bit careful. I still have a bit of pain. I do hope, not that I can walk downhill for 3 hours, but if there is a half hour going down somewhere, then I don't have any trouble anymore. That would be my goal.
Do you already do, apart from mountain climbing or running, I've now gathered, do you do any other sports as well? Yes, I believe one should move.
I do strength training twice a week. It's like brushing teeth.
Exactly.
Yes, one can't. It's just my training. I do it twice a week for my legs, for my back, arms, simply to strengthen the body.
Which everyone should do, not just you in your situation.
Yes, exactly.
Very good. Okay, wonderful. Yes, then I would say we thank you for your feedback on your experiences. And of course, we wish you that you have, as long as possible, or again, always, better able to walk through life on both legs equally and happily. Dear Mr. Heinis.
Yes, good.
Thank you very much.
I hope that Mr. Dr. Burgard can ease the pain from you people with this permission and can help.
Yes, certainly also through your help, because we have already heard some patients who were simply made aware of this therapy through our format. And you certainly also contribute to the idea or simply the experiences to carry forward and make people aware that it can also be a solution.
And once again, yes.
Thank you very much. Many thanks.
Many thanks.
All the best, Mr. Heinis. Goodbye.
Goodbye.
Yes, dear Harald, that was again great feedback from the patient with a wonderful experience he had. He hasn't been back for very long, but he's already achieved a great improvement, hasn't he?
Exactly.
Can you explain a little bit more for those who are hearing about it for the first time again, about gold implantation? How should I imagine that? The little pellets that are implanted there, we've heard that it's local anesthesia, and can you get up right away afterwards? I believe that wasn't quite clear.
Yes, so for the gentlemen and ladies who are listening to us now and aren't yet familiar, gold implantation means that pure gold, fine gold in small cylinders, is not placed inside the joint, but rather set around a joint capsule using needle technique, which then leads to the gold being dissolved by connective tissue cells, which in turn causes the inflammations in the joint that cause pain to recede.
Dazu führen, dass sich die Entzündungen, die im Gelenk sind und die Schmerzen machen, zurückbilden.
So inflammation goes down, swelling goes down, and thus the pain, and the gold remains inside for life. It is not used up over the course of a lifetime, and therefore has a lasting effect. And it is a treatment that is performed under local anesthesia. This means there's no need for hospital stay or general anesthesia. You can also do that with people who are not operable, older people, or those with heart conditions, and so on. And the nice thing is, simply you really get up afterwards and go home.
And you go home? You are not carried or wheeled, but you can walk with crutches or something like that.
No. Not even when we do this on the spine or the hips. The people can walk quite normally. And with him, there was a peculiarity. Most people come and have joint pain here in the inner area. With him, it was the other way around. He had it on the outside, and he is a tall person, and still it worked so quickly. And he also had an additional problem with his heel, which then led to him overloading the operated side, because on the opposite side, which was not yet operated on initially, he had the pain. He did have stronger knee pain here, but down there it hurt, the heel hurts, and then one naturally overworks the joint. Still, it has gotten much better in such a short time. And I always tell people you need 3 to 6 months for the effect to kick in. Here, it hasn't even been 2 months yet. We have also heard other cases where it happens much faster. But sometimes it just takes longer. And you don't want to give people false hope by saying it's very quick, and then they're disappointed. Instead, 3 to 6 months is realistic. After that, it continues to improve. We also see improvements after a year. But then the effect remains as it is, and it lasts a lifetime. That's the nice thing about it. You don't feel the gold. You can basically do everything. You can train, you can get treatment if you want to examine anything further. You can do an MRI. You can do everything without the gold bothering you, because it's not magnetic, because you don't feel it, because it just protrudes somewhere, and people can lead a perfectly normal life.
You should just communicate. You always say that you have gold implants so that the doctor...
When you have an X-ray taken, so that the people know, I know now, what it is. It's really alarming when you see a bunch of splinters. Or it also looks like the splinters are small cylinders.
Yes, of course, logically. How is it actually with knees? Because I've only ever heard of cases where first one and then the other is done. Can you actually do both at the same time?
Well, you can. Surgically, of course, do both in one session, but you need a certain amount of local anesthetics, and there are upper limits. And I need for a knee, or for a spine, or for a hip, so much local anesthetic that it is already at the upper limit with one joint, and then I can't do a second one. So with small things, when people come with thumb-based joints or toe-based joints, then I sometimes do both in one session. Technically, it's feasible, and time-wise too, but as I said, the limitation lies with anesthetics. And that's why, with the big joints, you do one. You can also do one and the other a day later. I've also done that when people come from abroad. But normally you do one, and then wait first to see if the other gets better. And if not, then you do it like in his case. Then after days, weeks, months later, years later, however it is, you do the other one. We often have patients who actually come and say, wow, the knee has gotten better, now let's do the hip or the spine or whatever, who actually get treated multiple times because it just helps them. And an alternative, as he already said, is taking painkillers continuously. This is not a real alternative because in the long term they simply damage organs. And in my opinion, that is the better method because there are usually no side effects. Of course, theoretically, like with any injection, an inflammation can occur and so on. Fortunately, we've never had that, but it can happen. We explain that to the people, of course. But otherwise, it is a low-risk or even risk-free procedure. And above all, we always have people who simply say, I can now go to rehab for weeks or have long hospital stays, and so on. The people come, they can go to work the next day. They don't need rehab. All of these are, of course, great advantages of such a treatment.
Yes, if you get an artificial knee or something like that, you first have to go to rehab.
Then you have to go to the hospital, then to rehab, and in between. You also can't jump around. That takes time, all months, until it is back in order. Until it is somewhat better, or can get relatively good, depending.
And artificial is simply artificial.
Yes, that's always it. And there are relatively many complications also with artificial joints. At the hip, it's about 10%. At the knee, even 25%, that need to be replaced because it didn't work. And those are simply complex things. And foreign materials or foreign joints are indeed foreign joints. If you ask someone with third teeth, which do you bite better with? They always say with my real ones, it was always best. And with real joints, you can simply run better. It has always been that way. And also at the spine. Instead of fusing the vertebrae, if it hurts, you can actually place gold at the respective spots. And the people afterwards also have no more pain. And that is a fine thing.
Are there situations or such far advanced degenerations where you say you can't continue with gold implantation now?
They certainly exist. So a contraindication is, of course, if someone has a tumor somewhere in the bone, or if someone has tumor pain, gold implantation doesn't help there. Another exclusion diagnosis is if a joint is crumbled, destroyed. That happens sometimes. It is very, very rare. But that's exactly why I always look at an MRI or X-ray beforehand, always imaging, so I can see what's going on there. I've also had patients where we were supposed to do the hip, but the hip had already slipped up from the socket and was crumbled. Of course, I don't do a gold implantation there, so you always have to know the limits and check. But that's maybe 1 out of 300 patients. But of course, you don't want to treat him unnecessarily, and then he has a problem afterward.
Yes, logically. Exactly. So where you really have a prospect that it works, that it makes sense. That's what you do, and everything else is also very honest.
Logical in any other therapy as well.
Yes, exactly. Does it pay? Does the health insurance cover it?
Well, the statutory insurances do not cover it. The private ones cover it very often. We've seen that often. We're talking about an amount of about 2,500 euros. And if you have such an operation and the insurance doesn't cover it, you can claim the costs because it's medically necessary as a tax-deductible expense. Of course, anyone who generates income can have it done. Thus, anyone can generate income. Otherwise, you just have to ask. Some might also cover it payable in installments. I've seen that once or twice too, but that's not guaranteed.
Yes, it's a shame. Because this is simply a therapeutic approach that would save so much more. Even a knee joint surgery would be many times more expensive.
Yes, we're easily looking at a factor of 10.
Yes, exactly. And yes, but it is what it is. And maybe for those who haven't heard it yet has heard of gold implantation, which is already a very old form of therapy.
I got to know it back then with my wife, who is a veterinarian. And I told her, just imagine, I learned about gold implantation. I had never heard of it before. She laughed and said, I've known that for ages. It's common practice in veterinary medicine. So in 1983, it was Dr. Dirks who first did it in animals in the USA. And Dr. Kjerke, just from Denmark, then adopted it for humans some years later, and he has been doing it for decades. There is university research dealing with it. Nowadays, these gold implants are used in the brain as well. Not by me, but by neurosurgeons, for example, against epilepsy, Parkinson's, and so on. And there are many other experiments, is because gold simply has very strong anti-inflammatory properties that have been known for thousands of years. Mummies have been found where gold threads are around the teeth or where gold plates have been embedded in the head, probably used for headaches, tooth inflammation, and so on. The anti-inflammatory metal, and we make use of that today because pure gold simply has no side effects. There are no allergies, it doesn't migrate, it stays where I put it, it also does not dissolve. We use so much that it lasts for a long time, so basically for a lifetime. These are all advantages and things that firstly trigger the effect and usually also ensure the effect. And above all, the whole thing goes without side effects, and it is a minimal intervention, which is what many people want.
Yes, very good. Thank you very much. Can you tell us where to find more information about you, your practice, or districts?
Yes, you can check under www.burgard.de. You can Google me with my name in Vodgassen in Saarland. You can find me there as well.
Very nice. Wonderful. Then I say a very heartfelt thank you for the insight into your work, and above all for the statements of your patient. And I wish you many more such great voices that come about, and may this form of therapy continue to spread, so it is remembered again.
That is the point, exactly.
And old methods that have proven themselves, that doesn't mean that old is bad, but what has proven itself, it would be nice if people simply maintained it.
Exactly. Wonderful. Thank you very much.
Dear Harald, thank you very much. All the best. I look forward to the next time. Many heartfelt thanks, dear viewers, also to you for accompanying us through the program. Please stay attentive, vigilant, and loving to yourself. And if you like, tune in next time again. I would be happy about that. Until then, goodbye. Ciao. Goodbye.
Thank you for watching Swiss Health TV QS24. Please don't forget to subscribe to the channel here above, because here you can watch all programs ad-free, but also to subscribe to our YouTube channel, as that helps us greatly. Here is a selection of programs compiled for you that you might also find interesting. All the best, until another time, and goodbye everyone.